You're watching Rogers TV, London.
Welcome to London Today. I'm your host, Missy Haggerty. I'm with Dr. Maria and Amanda from Synergy Center and Beauty Within. Thank you for being here, ladies.
Thank you so much for having us.
So I really wanted to talk about this topic because there seems to be a lot of mystery and also just people wondering how it all works and things, which is medical aesthetics. So I want to talk a little bit about your clinic, and one of my first questions is how do you find a good clinic and what sets you apart?
Well, absolutely. I mean, the first place to start is doing your research. So take a good look, see what you're getting into, see who is the injectors at the clinic. So a good place to start is Google reviews. You can start taking a look at the website for the clinic as well. Oftentimes on websites, they'll have biographies or little snippets about the providers.
Okay.
I do recommend taking the time to read those so that you know who is operating the clinic. Are they doctors? Are they nurses? Are they regulated professionals? Because these are medical procedures at the end of the day, and just taking a look to get to know them a little bit better. What did they go to school for? What kind of education do they have? And a lot of times it should include, what types of training they've had, medical aesthetics specifically, so you can get a bit of a hint about who the person is before you walk into the clinic, and maybe start building that trust even before you step into the clinic.
I think you touched on it, but I don't think people realize it's medical.
Absolutely.
And so you really have to look at your provider well.
Absolutely. It's aesthetic and it's optional. It's not, a medical need, but it's still a medical procedure.
What sets you apart, Dr. Maria?
I would like to say that we strive for excellence. This is what drives us. This is what sets us apart. Excellence in obtaining good cosmetic results for our patients, excellence in continuing to improve ourselves, to learn, to improve the technique, and excellence to make sure that everyone is treated well, has a good experience in the clinic, and we form a long-term relationship with our patients.
I think you probably also do a really great job with your staff and your team, because everyone that I've interacted with, you're all very connected and you all very mesh well together. And I think that's really important when people are looking for a place to get this done, because it's a very personal thing and it's a very personal experience, I think.
Absolutely.
Yes.
So I would say, hopefully, and we feel that we provide this, is that, from your first step in the door, or even before you get in the door, even just on the phone, that your experience starts off on the right foot, and every step along the way you're taken care of. So whether it's from the front desk staff to interacting with myself as the nurse, and every patient meets Dr. Maria here as well. So hopefully the experience is, kind, trustworthy. At the end of the day, we do strive to provide good results as well. But it's the experience as well. So we want you overall to feel taken care of and heard.
Well, and you need, especially first time doing anything like that, you need a little bit of hand holding, I think. And it's just nice that the process is very seamless.
Absolutely. We strive for that.
So tell me the difference. And this is the big thing that I think a lot of people don't understand, which is the difference between Botox and the difference between filler.
I will answer this.
Absolutely.
The Botox is a neuromodulator that relaxes the muscle that actually pulls the skin when it contracts.
Okay.
So if the muscle underneath the skin is relaxed, the skin is not wrinkled. So that's Botox, or the neuromodulator. The filler is a soft gel, mostly composed of hyaluronic acid. There are other type of fillers out there, but the hyaluronic acid is the most used.
Okay.
The hyaluronic acid is a component, it's a sugar that is naturally occurring in our skin.
Okay.
And we inject that in different layers of the skin, or the fat underneath the skin, or on top of the bone, to lift the skin, to replenish the volume that is lost with aging.
So as you age, you lose that volume then?
Absolutely. Unfortunately, aging affects many different layers.
Yeah.
So we're looking at, changes down to the bone level, changes in our muscles. Sometimes they get a little bit stretched out or thinner. They're not as strong anymore, or some become overactive even. Differences in the fat layers and the way things like to kind of shift. They like to come down and kind of come towards the center of the face, giving us a heavy look. So ideally, these treatments are to refresh, not give a totally different look, it's still you, but really rejuvenate those tissues where the changes have taken place.
So what I'm getting from you both is you should make sure that whatever place you choose, you get a very good consult beforehand, and that there should be a doctor present for the consult, or at least some part of the process.
For sure, keep in mind it's a medical procedure, so definitely we need to obtain medical history. We need to understand everyone's medical profile, medication that they take, allergies, and of course we need to understand their aesthetic goals. There are many models out there, models that work with doctors alone, models like our clinic that is a doctor-nurse model, or models that work with nurses alone. So just make sure that you are in good hands. Sometimes I see in our patients they go to 2 to 3 clinics before they make a decision. If that's the case, analyze who did take time to spend with you, assessing your needs, communicating well with you, educating you about the aging, about what is going on with your face, and then choose wisely. It's a medical profession, it's a medical act, and it needs to be treated seriously.
How do you decide, I always see people advertise by unit. How do you decide sort of how many units, and that you're not putting in too many units, I guess is what I'm trying to say, that you're just going in with exactly what they need for units?
So typically it all starts with a good consultation and a good assessment. And so that's why all of our first-time patients they meet with both myself and Dr. Tettelbaum, or one of the doctors on staff, so that we can take a good assessment. And that usually involves taking a look at the face at rest, but also in animation as well, because dosage or amount of a product is unique to everyone.
Okay.
So, you or I might need a different dose or a number of units of Botox to get us a certain result that we're looking for. Oftentimes we take into account, well, I shouldn't say oftentimes, we always take into account the strength of your muscles, the size of the muscles, the amount of activity that you use on a daily basis for them, because if you're always making one same expression, you're always frowning or squinting at the computer screen, you're going to start notice a furrow appearing between the eyebrows. And we take a look at how you use your muscles when it comes to Botox to help us determine that dose. Men do take a little bit of a larger dose than females, so there is definitely a difference in between the sizes and strength of muscles in between the males and females, so we also take that into account as well.
What kind of maintenance should people be doing in between treatments? I would expect your ideal person is somebody who naturally likes to take care of their own skin well in between.
So with Botox treatments, we usually recommend a treatment every 3 to 4 months. And with filler, once we completed the treatment, so we reversed most of the activated aging trigger points, then we'll do once a year maintenance for the filler, much less in volume than the original treatment. Okay. Even the original treatment, sometimes we need volume, especially in people that lost a lot, or people that have facial deficiency, like we have even younger people that present with bone deficiency, small retruded chin, or small cheekbones, right? Narrow cheekbones. So those people will need volume. And sometimes that treatment is split in several sessions. After we complete all the sessions, then maintenance once a year with filler is recommended.
And when should people start down this road? Like some people, I think that they start when they see the lines and the wrinkles happening, but maybe it might be better to start sooner than that to make it more effective?
Well, of course, we don't get too hung up on the age specifically, because some of us do start to age or show signs of aging before our peers that are the same age. Sometimes we just have structural differences or things that have been inherited genetically, so we're predisposed to aging in certain areas. We like to call them aging trigger points. They start to age before your actual biological age and can make you look older than you are. It is good to get ahead of those ones and start to address them earlier on. But of course, there's not a specific age we would say that you start at. We do see, late 20s and 30-year-olds, absolutely, but those are more so addressing the aging trigger points.
So out of curiosity, if someone starts in their late 20s, is it by the time they're in their 40s and their 50s, is it become less effective because they've been doing it for a long period of time, or does it just stay as like maintenance and they still see the effects of it?
Yeah, the opposite. When people start early, sometimes we prevent that deep permanent lines forming. Initially, they might have just wrinkles in certain expressions and just very fine lines. With age, progressing in life and repeating those expressions, then they will form permanent lines. So repeating Botox treatment will prevent those deep lines for forming. Same as we said, people with people with structural deficiencies, when you build up their cheeks or their chin, you stimulate the skin to produce collagen, so the filler will get integrated in their tissue and they'll form their own tissue to correct their deficiencies. So this will just improve over time. So there is a myth that we get immune to Botox or
That's
to
the word I was looking for, immune.
To the neuromodulators. Yeah. No, there is a word that we say myomodulation. The muscles do adjust their function upon treatment, and we see a big improvement in the overall face expression.
Is it good to do sort of a combination of Botox and filler? Is that...
Yes, absolutely. So combination treatment is ideal, but of course we're not going to recommend a treatment that's not applicable. It just so happens that a combination of neuromodulator treatments and filler treatments happen to give an overall good look. Then we can address some of the wrinkles and lines that are caused by expressions with the neuromodulator and address the volume loss, descent, and repositioning of tissues with the fillers.
Okay. Well, thank you for being here, Dr. Maria and Amanda. It was a pleasure having you. And thank you for educating us so well on this topic. It's kind of a scary topic.
Well, thank you for us, for sure. Now with people living longer, everyone wants to look their best. So I think the medical aesthetic is growing rapidly. So we'll need more education. We'll need to talk about that. Before it was taboo. Nobody wanted to share their story. I think more and more people come out because we see the good effects of it.
Well, thank you for being here.
Thank you.
Thank you so much for having us.
Your happy place. Easy 1013, the perfect music mix.
Night's action on Rogers TV.
Welcome back to London Today. I'm with John from Junction Climbing and J2. Thank you for being here, John.
Thank you.
So tell me all about Junction Climbing and then your new facility, J2, that you've built.
Of course. So Junction Climbing opened in 2014. We wanted to be a what you call a full-service climbing center. We built a 12,000 square foot facility not too far from here in the East Village. We've got route climbing, we've got lead climbing, we've got bouldering, we've got a training area, and it really has all the styles of climbing anyone wanting to do the sport could ask for.
Under one roof.
Under one roof. Under very tall, under one very tall roof. There's a particular style of climbing called bouldering that's been growing really fast. It's really accessible. It's really fun. And over the first few years of our operation, we realized that our bouldering space just wasn't big enough. That we needed to find a way to expand that. And starting a few years ago, we started looking at different properties. And this spring, we opened a spot up in Hyde Park called J2 Bouldering. That's just a bouldering gym. It's got amazing walls, beautiful natural light, tons of parking, and it's kind of like opening a specialty, taco restaurant only, whereas Junction's a restaurant that would serve kind of anything you could want to cook. So,
can you explain a little bit about each style of climbing that you just mentioned for our viewers?
Absolutely. So most folks, when they think about climbing, they think about a big wall with some colorful, what we call them holds, but some people call them rocks, but a bunch of colorful holds bolted to it, and there'll be a rope, and you climb up as high as you can get. That's sort of your classic rock climbing. Bouldering is shorter walls. You go up maybe 12, maybe 15 feet. There's no rope, just a pair of climbing shoes, and there's a big pad at the bottom as sort of your backup. And then then as you climb, you try to do the movements, and then either down climb, or if you feel safe, you can jump down on the big pad. The advantage to rope climbing is you just get to go a long way. You get to go up that long extended challenge. The advantage to bouldering is it's shorter, it's more intense. It's kind of like one's going for a jog for a couple kilometers and one's doing a sprint. They're both kind of running, but one's got a lot more power involved. And bouldering is that intense, powerful version. Because there's no rope, you can do movements that maybe you couldn't do on a roped wall. You can do jumps, you can do things that are upside down, you can do things that are traversing sideways. There's a lot of creative freedom in the climbing. It's absolutely fun, very accessible.
So my curious side asks, what happens if you get halfway up and you're tired and you need to come back down?
Yeah, so on the rope climb, that's a great question. On the rope climb, you just let go and the rope holds you.
Okay.
It's there to be your backup. It gives you a chance to rest. On a boulder, because you're not up very high, you can either jump down or climb down. You haven't gone that far.
One of the fascinating things that you told me, which I never thought about till you told me about it, was you actually change up the routes and the pathways all the time so that people are climbing different routes all the time.
Yeah, we go in, take a section of wall, pull all the holds down, wash them, and then put up a whole new set of fresh challenges.
So that probably motivates people.
Yeah, and every climb has a grade of difficulty marked on it, so you can say, this is where I'm climbing at, that's my level, and I'll try this one. If you feel like a challenge, you can pick a harder one. If you're having a day where you want to rest, we call those high gravity days, you can pick an easier challenge. And then a few weeks later, everything's pulled down and new ones are up, and you get a whole new set of challenges. Is
this something that you should bring a partner for, or is it something you can do on your own?
So when you're climbing on the rope walls, the classic way of climbing has you climbing with a partner. Mm-hmm. They operate the rope for you, you do the climbing, and then you will switch.
Okay.
That's called belaying, which is a climbing term, and the person working the rope is called a belayer. We teach classes on that. It's actually a great class to take. It takes about 90 minutes. You learn all the knots, you learn all the rope skills, and then for 2 weeks you get to come back to the gym as a member to practice all the skills you've learned. But lots of folks don't have a climbing partner all the time, or maybe they're not available, and so we have bouldering as that option where you can come in by yourself, do your workout. We also have what's called an auto belay, which is a machine that does the belaying for you. So there's lots of options for for people who are solo. Mm-hmm. It's also nice because you can come in for bouldering in a big group. So a place like J2, we have groups of 4, 5, 6, 8, 10 come in together, and people can climb. And because there's so many climbs, if you're coming in with a mix of friends who are experienced or inexperienced, that mix of abilities, everyone can find the challenge that works for them. That your competition is against the wall, not against each other. So unlike tennis, where you have to match the skill of the person you're playing with.
Exactly.
Yeah.
Is this something that you would do like corporate events with,
Yeah.
birthday parties,
We do lots
team
of
building. I
Sure.
think that's the word I'm looking for.
Yeah, absolutely. We do lots of birthday parties for kids. We do some corporate activities. We are always a little bit hesitant just because sometimes, for some people climbing, even with all the safety features and all the different challenges, it's going up high, and that's a lot of anxiety for folks. And so we always are very cautious to never push anybody to a place where they're not comfortable. And so for some team office environments, it's not quite the right fit.
I would say there's probably one or two in a group that probably don't want to do heights.
And that's totally fine. Being scared of heights is sort of a biologically useful thing, and we don't think it's something you necessarily need to get over, but for those folks who want that challenge, climbing is absolutely fantastic.
For a beginner, what kind of safety measures are in place for somebody? Because you and I talked a little bit about this, that it's often seen as an extreme sport, but it's actually not.
Yeah, it has this old reputation of being something done by, people who want a rush or a thrill, and there's still some folks out there that like that, but climbing is really for folks who want a challenge. Climbing tends to be very thoughtful because you have to figure out the sequence of movements to solve the climb. Mm-hmm. When you come into a climbing gym like ours, we will do a safety orientation for you. We'll take you through and show you how to fall safely, how to operate the equipment, the audible equipment. We will show you sort of how to pick climbs so you're on the right level of ability for your the right climb for your level of ability. And then, under all our boulders, we have, engineered design padding. Our ropes are inspected, our harnesses are inspected. We take a lot of care to make sure the gym is as safe as possible. And truthfully, because of all that, it's got if you were to research sport injury statistics, climbing has less injuries than volleyball, than soccer, than a lot of field sports, just because we don't have the same risk of collisions and the same risk of, twisting injuries. It's really something that we know can be risky, so we make sure we take as much of that risk out.
I almost look at it like it's methodical exercise, and it's great for people. There's a lot of people out there that want to exercise, but for whatever reason, bad knees or a bad knee or something, they can't have concussion.
Yeah, absolutely. No, it's a very methodical sport. It's a sport that rewards people who are patient and people who, are willing to find that precision in their movement. It's a lot of folks have come to climbing because they've been doing another sport, and whether it's through concussion injuries or limb injuries, they need a sport that doesn't have that risk of collision or that risk of impact. Because you're on a rope climbing, rope climbing especially doesn't allows those folks to be active and in a way that is not repetitive. Every climb is different. And you're not doing the same thing over and over again. And once you've mastered a climb, we're going to take it down and change it and put a new one up. Bouldering's a bit different. Bouldering, like we have at our new site, J2, you are jumping down. You are at a little more risk of landing. It's kind of what people like about the sport. So, really what's nice is we've got the option for those folks who want the rope and the protection that brings, and we've got bouldering, which lets people who want that extra power and intensity be there for them.
What's your preference?
I like rope climbing. I am getting old enough that my knees don't handle jumping down.
I was just going to say, I feel like you like the rope climbing. When somebody is looking at coming to your facility, is it like a membership that you get, or is it you pay as you go?
We have both.
Okay.
So folks who want to do it all the time, they get a membership. It's just like going to the gym. Folks who wanted to come check it out, you can pay for the day. The one piece of paperwork I always need to mention is that we do have, even with all our safety steps, our insurance company says we need to have a signed waiver for everybody who comes to visit, and that anyone under 18 has to have that waiver filled out by a parent. We make it easy. We have the waivers online at junctionclimbing.com and j2bouldering.com, so you can do the waiver before you come. But if you're, being the cool aunt and bringing your nephews and nieces for their birthday, make sure you get the parents to do their waiver before you come.
Do you ever have anyone get halfway up and they kind of panic?
Not a lot. If someone's nervous, they can always just let go or climb down. The thing we've learned is forcing people to do a thing is going to make them, you might eventually do it, but you'll never want to do it again. And so we really encourage people to find the climb the style of climbing that matches what they want to do, and the if they're not having a good time, you can let go of the wall, come back to the ground. You're never stuck up there.
And don't panic.
And don't panic. And if you're panicking, let go, and then you'll come down.
How often do you find, so somebody who's probably an avid climber, how often do they come to your facility a week?
A regular climber is coming 2-3 days a week. We've got members who come 5-6 days a week. We have lots of folks, will come. We have a 10 pass option.
Okay.
So if your schedule is, you love it, but you don't want to come, you can't come all the time.
Yep.
We do have those 10 passes as an option to save some money, but still have regular access to the gym.
Is your sort of preference for beginners to start out at Junction first?
I think Junction's great because Junction allows you to try all the styles.
Okay.
And then if you really like bouldering, you can head up to J2 and max out on that. Bouldering is really, really growing fast because it doesn't have the extra equipment required. You just need a pair of climbing shoes. A pair of climbing shoes is $120 for a cheap pair, and you're into the sport. Bouldering also is really popular with folks because you can do it on your own schedule. You don't need to book a time slot. You don't need to wait for a piece of equipment. You would at another gym, you just go to the wall, and it's such a big facility. There's tons of stuff.
Well, thank you for being here, John.
Thank you. Thanks for having us.
And we'll see you next time on London Today.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Watching hockey just got a power play with NHL Center Ice and Super Sports Pack. With up to 37 out-of-market NHL games a week, you'll always catch your favorite team no matter where you live. Whether it's big matchups you're looking for or following your top fantasy picks, it's all here. NHL Center Ice, part of the Rogers Super Sports Pack. All this for only $35.95 a month. Say Super Sports Pack into your voice remote to order.
Closed captioning is brought to you in part by Raven Reads. Unbox Indigenous voices. Subscribe today at ravenreads.org.